A new report from the Asthma and Allergy Foundation of America, AAFA, is turning national attention to a growing public health concern. Asthma rates are on the rise, and some U.S. cities are facing far greater challenges than others. St. Louis ranks number 32. The 2025 Asthma Capitals Report, released when asthma emergencies peak each year in September, ranks the most difficult places to live with asthma and offers recommendations for asthma management. Now, joining us is Kenneth Mendez, President and CEO of AAFA, along with Dr. Matthew GREEN-haut, AAFA's Chief Medical Officer, to break down the findings and explain what's driving the data and share how cities can better support vulnerable populations as we enter a perfect storm for worsening asthma. It's that time of year, guys, and I'm a football player. And guess what? When I hit that grass in the fall, I had problems. So, Kenneth, what does the report reveal about asthma trends in the U.S.?
Sure. Well, our report looks at the 100 largest cities and the ones that are most challenging to live in with asthma. And we use three things to measure that: asthma prevalence, asthma ER visits, and asthma mortality. So if you rank high in any one of those areas, you rank higher on the report. St. Louis is 32nd overall in the report. It's the fifth most challenging to live in the Midwest. But if you look at the entire country, St. Louis has the second highest asthma-related death rate of all the cities that we analyzed. It's got the eighth highest poverty rate and eighth highest rescue medication usage. So all those things are indicators of high asthma prevalence and a chronic condition that still needs to be addressed, not only in St. Louis, but across our country.
Now, Dr. GREEN-haut, what exactly is the September asthma peak, and why do asthma emergencies spike so dramatically in mid-September?
September represents a very challenging month to clinicians. You sort of have this perfect storm of a number of factors that just sort of uniquely intersect at this time of year. All of them can trigger asthma. Sometimes more than one thing are triggering asthma. And this just sort of creates a surge of emergency department visits and subsequent hospitalizations because your airways are just triggered. So let's start with allergens. This is peak ragweed season right now. So ragweed levels are surging through sort of September into the early fall, as well as mold levels, which will remain elevated until the ground starts to freeze. So got two very prominent allergen triggers. Kids returning to school. This is where we start to pass respiratory viruses between the children, and then they can bring that home to a sibling or to an adult. And you know, these infections can be very, very prominent triggers of asthma. The indoor air quality in certain buildings and schools or whatnot, that can be a problem. There can be mold or whatnot in the ducts. There can be dust around. And just frankly, some of the cleaning solutions can be quite irritating to the airways. And then you have natural disasters, so things like wildfires and other things that are producing smoke that can be really, really prominent triggers. And not in St. Louis, unless we're all in trouble, but hurricanes or whatnot. You know, and in sort of the coastal areas, this can be another issue that just sort of is associated with the September flare.
Now, doctor, how do people know when their asthma is worsening, and what can they do to protect themselves during the challenging month and all year?
Yeah, preparedness is key. So it starts with recognizing symptoms of your asthma: increasing cough, wheezing, difficulty getting the air out as opposed to getting the air in. You may start waking up at night coughing more or whatnot. You'll be short of breath. That can lead to chest tightness and pain. And then your activity levels will start to be reduced. So if you're outside exercising, playing sports, or whatever you're doing outside, you might find it harder to be outside and doing these activities, or even indoor activities as well. For your kids, they're not going to want to come off the field or anything like that, but they're going to be coughing a lot more. They may not be able to go as long as they normally would. So you'll see the physical sort of aspects of it. The best thing to do in terms of preparing yourself is to be in touch with whoever is taking care of your asthma, making sure that you have an action plan in place. An action plan is a really simple piece of paper that puts asthma into 3 zones: green, doing well; yellow, starting to struggle; red, really struggling. And it tells you sort of what you should be doing in terms of your medications and your steps at each stage. So when you start moving from from green to yellow to red, you are prepared and can sort of meet each zone with the medications that you need. In terms of medications, if you prescribe medication for asthma, please fill it or refill it. Please also take it. Take it as close to, if not perfectly, as we tell you to do it. I know that not everybody does that, but this is the time of year when you really do not want to sort of not be doing that. And if you have emergency medications, make sure that you have that with you at all times in case you're out and you start to have an exacerbation. In terms of other things that you can do to prepare, talk to whomever's taking care of your asthma about, would a vaccine help me here, especially if you're prone to some respiratory illness triggers that cause this. You may not feel that all vaccines are effective or even work, but you'd be surprised. Even, something that you feel isn't working, a small difference can go a long way into preventing sort of an asthma flare. If you feel that you need additional care, talk to whomever's taking care of your asthma about seeing a specialist. I know the allergists in the St. Louis area really, really well. You have some of the best in the U.S. At your disposal in St. Louis. If not a board certified allergist, immunologist, a pulmonary specialist, these are all people who can help personalize your asthma care. That asthma plan that I was talking about, you can go to www.aafa.org. You can download this in English. You can download this in Spanish, and it allows you and your care provider to tailor the care and individualize it to what you need, because not everybody's needs are the same in asthma, and not everybody's triggers are the same.
Kenneth, AAFA notes there are serious disparities in asthma care. Can you talk about how race, income, and access to healthcare play a role in outcomes?
Sure. The communities that rank high on our asthma capitals report tend to have more Black and Hispanic populations. And Black Americans are 3 times more likely to die from asthma, 5 times more likely to be treated in an emergency room. And unfortunately, Black women have the highest mortality rate of any gender or ethnic group. And when you look at children with asthma, 50% of them are on Medicaid or CHIP, the Children's Healthcare Insurance Program. So losing access to care, so losing health insurance, losing Medicaid coverage or CHIP coverage will have a major impact on our communities, and that's what we're really worried about. No one needs to die from asthma. It costs the healthcare system $115 billion. And we believe that by taking proper medications, by having upstream care, you can reduce emergency room visits and hospitalizations. If you visit our website, aafa.org, not only can you find our asthma capitals report there, but a lot of information that'll help you if you have asthma and allergies. We have an Ask the Allergist section of the website. It's completely free, and it's one of the services that we offer as a nonprofit organization.
Kenneth, Dr. GREEN-haut, thank you so much for joining us on Morning Bloom. I really appreciate it. It's a very important subject we need to talk about, not only in St. Louis, but in other series. Thank you again.
Thank you.